All right, joining us now to talk more about the coronavirus outbreak in this country and what we might see with the new Biden administration and a potential shift in strategy. Dr. Vanila Singh, clinical professor at Stanford School of Medicine, and also the former chief medical officer with the Department of Health and Human Services. Dr. Singh, great to have you on here.
Great to be on again. Thank you, Alex.
All right, so obviously we have a new administration taking over right now, and obviously facing this massive crisis of trying to address the skyrocketing number of coronavirus cases, and really it would seem one of the major focuses is going to be trying to get more people vaccinated in this country, and it's something that's been easier said than done so far. The administration is coming in and promising to ramp up production of the vaccine, get more doses out to states and folks on the local level. How do you think they're going to go about doing that?
Yeah, so this is such a good thing to hear about with the Biden administration's goal of 100 million doses in 100 days. Just because we need to keep our sights high, we need to ensure that we keep on the vaccine campaign to get that vaccine dose into people's arms, because that alone will provide that immunity to vulnerable people and really help our statistics in terms of those folks who are suffering from the disease or worse yet are succumbing to it. So that is a very important goal. They are going to take a much greater federal perspective and national strategy, whereas the Trump administration was providing the vaccine and the testing, but they were leaving it up to the states on how they went about it. So this will hopefully bring some more coordination. I'm sure that's the idea, and direction, because a lot of states, including unfortunately California, have had a bit of a slow rollout campaign, which has been certainly concerning. And so I think that's actually a good response at this time.
Yeah, and so what we were hearing as recently as last week, was that places like California were had only administered a fraction of the doses they had received from the federal government. We're starting to sort of see the narrative shift a little bit on the state and the local level, where now you're hearing folks saying, like the city of San Francisco said the other day, we want to we have the ability to give out a whole bunch of vaccines, but we expect that our supply is going to run out here at the end of this week. So now we're starting to sort of hear that, on the local level, they need more supply. How does the federal government get the Pfizers, the Modernas, and the other pharmaceutical companies who are involved in creating vaccines? How do we get more supply out to the American people? What tools does the federal government have to ramp that up?
Yes, so that's a great question. And it's something actually that the prior administration and the current one are doing, which is really ensuring that they can purchase mass amounts. It gives the ability for these companies to certainly maximize their investment in manufacturing that. And that is already happening. They have to then think about their supply chain, who's providing the different ingredients. And the federal government can certainly help that with coordination. There is the Defense Production Act, which now President Biden has said that he will look towards. They didn't have specifics yet, but I'm certain they're going to utilize that. The Trump administration did as well. And so this is going to be, I think, highlighted, because we know we need more doses, especially because we want to expand the criteria more rapid than was originally thought, just because of the coordination for the vulnerable folks out there.
Yeah, and so you touched on that, because some folks are maybe concerned that we don't have enough, it would seem, in terms of supply of vaccine doses. Yet we're expanding the population that's eligible to be able to get the shots. We're expanding it here in California, for instance. Anyone over the age of 65 is authorized theoretically to be able to get the vaccine. So we're opening up this pool to more folks, or creating a larger pool of folks who are eligible for the shots, but we don't have enough vaccine. Do you worry that you might vaccinate folks? We might give folks their first shot, but since we've expanded the eligibility pool, when they come back around looking for their second shot, it might not be there.
Yeah, so actually, this is a really good, important point to make. Number one, the real reason to expand it earlier rather than later is because we saw so many slots going unfilled. And it's not mandatory for most people, including healthcare workers. And even the airlines now are saying that Southwest was saying they want to give their employees the vaccine dose. So yeah, there's an expansion of criteria. However, not everybody is keen on doing it, so you get a lot of unfilled spots. This improves the efficiency, the ability to ensure that someone is there and getting the vaccine dose, which I'm all for, and I think it's going to be really important. I'm more for it than I am worried about the consequences of us not having enough, because I think the supply will be there, and we are seeing potential more manufacturers like Johnson and Johnson on the horizon who will also be part of the makeup of people who get the vaccine. So I think that's number one, very important. Number two, supply chain, just from a worldwide perspective, a lot of countries are involved in this. The US is now entering back with the World Health Organization. My hope is that that means we'll have better coordination with worldwide public health officials and agencies to really get a mass coordination effort. Not that it wasn't there, but we know that we're in this next phase where we really want to ensure that we have more rather than less vaccinations available. This also will allow for coordination for other countries too that are unlikely to get the same efficiency as us. We want to ensure that other countries are also getting it so that we don't end up getting the secondary issues that occur with travel, which will ultimately resume. And we just want to make sure that this virus is held at bay.
All right. So the other wrinkle in all of this, as you as you well know, we have talked about before, is the fact that the coronavirus is mutating, and there are a couple of different variants out there. Of course, the most notable, the one that was first uncovered in the UK and has made its way around the world to other countries, and a couple of other variants as well. It does appear, and you've brought this up before. It does appear that these variants, some of them at least, are more transmissible. There's the question of whether or not they actually might make people have a more severe illness. But it seems like the real key question here, as we ramp up the vaccination effort in this country, is whether the coronavirus is going to mutate enough to the point where the current vaccine that we've created is not going to be effective. Big picture, I mean, how much do you worry about that?
Well, we know that it's possible. We know that the effectiveness can go from a 95%, which is what the clinical trials are showing for both Pfizer and Moderna, to a less because of that mutation that might happen to a variant that is harder to treat with the current vaccine. That is something that I think everybody has to already be thinking about. We have to think about it with the flu vaccine every year. There's a change, some minor change, sometimes a bigger over time. So that is something that has to be on the forefront with researchers, with R&D. The CDC should be monitoring it as they are. So that just the news of that in South Africa and Australia and other places of these new variants, I think poses a potential problem, but it should not in any way limit the enthusiasm that people may have for getting this vaccine right now, because what we know definitively is the current strain is real and it's there, and it has certainly caused a surge since December. So
Right.
that's real, that's definitive. The other one is theoretical right now.
But correct me if I'm wrong, but I mean, the more people we get vaccinated with this current vaccine, even if you have variants out there that might be, that the vaccine might not be as effective against, if you get enough of the population vaccinated with this current vaccine, you can slow the spread of these variants, right? I mean, there's just fewer people for the virus to travel between.
Exactly. Absolutely. That's exactly right. COVID-19, the disease itself as it stands now, it will be better for us to get vaccinated, to have the immunity on a large scale, both from the natural infections, but especially from the vaccine doses, so that we just don't have the virus as important in our population. And therefore, even if there's a mutation here and there, it just doesn't spread as much. So that's going to be a very important point to keep in mind for folks. And the current variations out of the UK, they are still susceptible to the vaccine dose, meaning our vaccinations are still effective against the current understood variation. So it is always something that I think epidemiologists, all our public health agencies are looking at, our infectious disease folks are always thinking about. But fortunately, right now, as it stands, we know that the vaccines work even against the variants.
All right, and I guess the last question on the vaccine issue, looking down the road, could there be that possibility that we have to modify the vaccine in some way in the future? I mean, I know you talked about how the flu vaccine, obviously, as we know, changes every year, right? To try to to try to be effective against the current strains of the flu that are out there. Is that kind of where we might be going with the coronavirus vaccine?
Yeah, absolutely. I mean, look, the major hurdle is done where we have utilized the mRNA current technology. We had a head start because Moderna, as other scientific experts, were already trying to do this with the MERS, the Middle East Respiratory Syndrome virus, which is the same family as a COVID-19. And because of that, we were able to do this in an expedited fashion. And that is the big hurdle. So having variations of our vaccine to combat variations of the virus is something that we will be able to do, I have no doubt. And that is already being probably checked by so many different folks in our country and around the world. But our current vaccines are really effective. I mean, 95% was much more than we could have even imagined. Other countries are, in fact, vaccinating with far less effective vaccinations, including India, which I think has one that's at 65%. And those are still considered actually pretty good. So we're in really good shape right now. And I like that we are keeping tabs on these different variants out there because it
Yeah.
just shows that we're keeping up with the science and the latest emerging issues related to the COVID-19 virus.
Yeah, it's important to kind of really, right, obviously for the scientific community to keep your eyes on those variants and see how things develop with them. I did just hear Dr. Fauci a short time ago at the White House briefing, and he said that he thinks that we could have most of the population in this country vaccinated by the middle of this year. Once you start to really get an effective rollout, these mass vaccination sites start to just really ramp up their operations. Eventually, you get the vaccine being administered, hopefully, in pharmacies across the country. Just to sort of the general population. But what do you think about that from Dr. Fauci? The middle of this year, after the summer, maybe having a majority of people in this country vaccinated?
Yeah, I mean, I think it's very possible, and I agree with him. I think that has been actually a goal all along. Uh, CVS, Walgreens, other major national chains, and independent pharmacies have been brought into the mix, as well as other easy to reach places for the population. So they're on it. The fact that it hasn't already happened instantaneously wasn't a surprise. It's just that we're, of course, impatient to get the vaccine out there. But I think as the coming weeks come, we're able to unroll where our logistics are and how to better do it. As some states have already demonstrated what works, and other states are learning from that. So I think it's absolutely feasible that we have a mass vaccination campaign that gets us to where we want to be by the summer. I think that's been the goal, and I'd be surprised that we wouldn't get there. There's always going to be hiccups along the way,
Sure.
and there could again be variations in the virus that may change those goalposts. But at the end of the day, we have to try to get that. And I think that with the flu vaccine campaign every year, we're actually demonstrating as a country that we do that actually pretty effectively.
Yeah. So finally, here as we wrap up, just sort of looking at how things, we expect things might shift and how the approach might change under a new administration. I'm sure you saw yesterday the shortly after the inauguration, and President Biden signed a number of executive orders right off the bat. The first of which was, surprisingly, not surprisingly, I should say, had to do with the coronavirus, and it was a mask mandate to making sure that people are saying that people have to wear masks when they're on federal property. Today, he also issued another order having to do with the pandemic, requiring masks when people travel, planes, trains, buses, those sorts of things. What sort of a message do you think the incoming administration is trying to send with mandates like that? What are they trying to? They're trying to suggest that their approach is going to be different than the previous administration. I mean, obviously President Trump, for him, former President Trump, masks were sort of an optional thing. I mean, what do you think we're going to see in terms of the change in approach?
Well, one, I think that what the private citizens have had to go through with varying mask mandates in different places. Of course, California has had a very strict one from the start. I think it's an important point that the federal agencies are doing that to protect their own employees, but also role modeling what has been a very massive challenging time for a lot of people. So I think that's a very important point. And they can only have a mandate in a couple of areas. One is the federal agencies, and also for anything international overseas, and they're doing both. I think we also were already doing the 3-day testing before folks came in. The State Department had already had warnings on travel to so many countries. It was an incredible list to see. Of course, in its unusual countries like the UK and Europe, which normally we don't have there because these are usually warnings about malaria and other endemic issues. This is a pandemic, and it was such an expansive list. So those travel warnings have to stay there, but we want to ensure that we protect Americans from folks who are traveling overseas, and they may not have the same requirements in their native countries, or it may vary in terms of their testing and their vaccines. And so it's really important that we have that. And I agree with that, actually. At this stage where we are in terms of a very nascent vaccination campaign, I think it is important to be protective in that manner.
And I'm sure you heard the incoming administration, along with promising 100 million doses being administered, doses of the vaccine being administered in the first 100 days. At the same time, President Biden also urging Americans for the first 100 days, for at least 100 days, hopefully more, but to just ask everyone to take the bare minimum in terms of safety measures to try to slow the spread of the virus here. That's sort of his ask of the American people. And so we'll obviously see how that goes, and which direction we see the numbers go here. But hopefully the vaccination effort sort of ramps up, and we get to most folks being vaccinated at some point later this year. It's encouraging to try to think about that, isn't it? I mean, for me, it is. It gives me some hope.
Absolutely. I mean, you know what? This is the fun of, say, a new administration. They come with fresh eyes, and the first 100 days are where so much momentum is before politics as usual will likely play, although I hope it doesn't. But, this is a very important time because of the pandemic and a new administration. And they have clearly shown that they're prioritizing this as well as some other issues. But this is something that is front and center. And I think the American people want it to be. Also, it was a transition time. We just unveiled the vaccinations being approved with the FDA, and suddenly within weeks, it's people are getting vaccinated, and to keep that momentum going is
Yeah.
critical. And politics really shouldn't have a role in this, quite frankly. And I'm happy to see that momentum at the end is now continued, and hopefully we'll put our foot on the accelerator and continue it.
Yeah, well, certainly the Biden administration focused, a laser-like focus on the pandemic, and really trying to ramp up vaccine production and the rollout there. So we'll see how it all plays out. We'll be here to discuss it. We'll talk again next week. Thank you so much for coming on to break all of this down. We appreciate it. Dr. Vanila Singh, clinical professor at Stanford School of Medicine and former chief medical officer with the Department of Health and Human Services. Always appreciate your time and your insight. Thank you.
Thank you.